Hello, my name is Grace DeBoer. I'm going to be discussing parturient paresis, also called milk fever, mentioning the common causes, symptoms, diagnosis, treatments, and preventative options. In a review by Fickadoo, he mentions that calcium is the most abundant mineral in the body and is an integral part of bone and nerve tissue. Calcium functions in the bone matrix with muscle contractions and the conduction of nerve impulses. Most well-managed pastures will supply the necessary calcium requirements. Legumes will contain the highest percentage of calcium, whereas grain will be low in calcium. Calcium requirements increase for lactating dairy cows due to the high calcium content in milk. Colostrum alone, the milk produced within the first 24 hours after calving, contains 2 to 2.3 grams per liter of calcium. During the first 6 to 8 weeks of lactation, cows are in a negative calcium balance. This negative balance can lead to the breakdown of bone in order to meet calcium requirements. For this reason, inorganic sources of calcium, which are absorbed easier than organic forms, must be supplemented in the diet to avoid complications. Also, while it seems like dairy cows should be the only ones affected, beef cattle can be at risk as well. So, what is milk fever? Milk fever is a metabolic disorder that affects 5 to 8% of lactating beef and dairy cattle as a result of low blood calcium levels, or hypocalcemia. The disorder can occur before, during, or shortly after giving birth to the calf, but 80% of cases will occur after calving. Current research focuses on how to prevent this disorder from occurring so that producers will not be at a loss. The high percentage of milk fever cases occurring after calving is due to the high volume of milk ejected after parturition. According to an article by Akalu, a cow producing 10 liters of colostrum is losing about 23 grams of calcium, which is 9 times as much calcium present in the entire calcium pool of the cow. Now that is a lot of calcium. If the cow is not receiving adequate calcium levels in the diet, the cow may not have enough calcium to support her own body. Normally, plasma calcium levels are controlled by parathyroid hormone. This hormone works to prevent hypocalcemia. However, when calcium levels are extremely low, the continued parathyroid hormone release stimulates resorption of calcium that is stored in the bone. When calcium levels drop below normal levels, the hypocalcemia will begin to affect the nervous system and muscles. It is important to note that milk fever can be caused by other factors other than the events surrounding lactation, such as mineral imbalances or infection, but most cases will be associated with lactation. So why does this disorder even matter? Milk fever has the potential to drastically affect the productivity of the animal. Just by contracting the disorder, the animal's productive life decreases by 3 to 5 years. In an article by Akalu, he estimates the average cost for each case of milk fever is around $334. Furthermore, cows that suffer from milk fever usually are susceptible to many more secondary problems, thus increasing the cost for the producer. The prevention of milk fever has the potential to benefit the health and productivity of the animal, therefore decreasing losses and increasing gain. Clinical signs of milk fever usually occur in 3 stages. The first stage of milk fever occurs within the first hour of the disorder. At this point, the symptoms are not very severe and are easy to miss. The cow may shift weight from side to side, act nervous or spooky, or present with a loss of appetite. Stage 2 is where owners commonly first detect a problem. This stage can last anywhere from 1 to 12 hours. Common symptoms include stretching of the neck towards the flank region, appearing to be weak and lethargic, an increased heart rate above 120 beats per minute, decreased temperature, and potentially constipation due to low calcium levels affecting muscle contractions. The animal can also present with trouble walking. Stage 3 is progressive muscular paralysis that may lead to coma or death without treatment. Diagnosis of milk fever needs to occur fairly rapidly in order to have a positive outcome. In the article by Fickadoo, he states that diagnosis can be made by a history of the animal, clinical signs, age of the dam, and response to intravenous calcium borogluconate. In order to confirm the diagnosis, blood work can be pulled and run. If the blood work comes back with low blood calcium, low blood phosphate, or high blood magnesium, the animal is likely suffering from milk fever. If milk fever is suspected, call your veterinarian immediately. Early detection is key to successful treatment. Veterinarians will administer either intravenous or subcutaneous solutions containing calcium and other minerals. Cows will require anywhere from 300 to 600 milliliters of solution, depending on the severity of the disorder. Once adequate fluid has been received, the cow should be on her feet quickly and make a full recovery. While treatment is very effective in the early stages, treatment can be variable during stage 3. Intravenous fluids should only be administered by a veterinarian due to the high risk of making a fatal mistake. There are, however, several things that can be done before the vet arrives. Bloat can occur when gases build up in the rumen and are unable to escape. Bloat occurs more when the animal is laying on her side. Make sure she is propped up to prevent or relieve bloat. Also, monitor the cow and the stage of the disorder. If the cow becomes comatose, there is a chance of aspiration, which is where liquid enters the lung. So it will be crucial that the vet is aware of this information. Lastly, try to move the cow to an indoor location to protect the animal from environmental conditions. In an article by Ficadou, he advised that prevention of milk fever is economically important for the dairy farmer. The prevention of the condition minimizes production loss, death loss, and veterinary costs associated with clinical cases. Prevention of milk fever can be very successful when performed correctly. When the incidence of milk fever increases above 10% in late gestation or early lactation, producers should implement a control program, such as low calcium diet during the end of gestation. By doing this, the body's calcium regulatory system keeps blood levels normal by mobilizing body stores of calcium from the bone and activating parathyroid hormone secretion. In effect, the body is being prepped to have efficient utilization of calcium from the bone when calcium demands increase. Programs may also include oral drenching around calving with a supplement of calcium or feeding acidifying rations by anionic salt supplementation around the end of gestation. Lush green grasses and alfalfa tend to have high levels of potassium, which may contribute to the onset of milk fever. Feeding hay 1 to 2 weeks before calving will help prevent this situation. When cows are close to calving, they should be kept close so they can be periodically monitored for milk fever. As mentioned earlier, an early detection of this disorder will help to have effective treatment. If dietary management is unsuccessful, calcium borogluconate can be injected just before or just after calving. The injection helps to provide a reservoir to increase blood calcium levels just in time for increased ejection of milk and colostrum. Thank you for watching. Here are my references, and hopefully you have learned more about milk fever today.